Hi, I'm Dr. Kathleen Reidy. And first, I'd like to thank the Cancer Resource Center and Jennifer and Carla for having me present to you today, and for their technological assistance as well, because I need it. So I'm a psychologist and had a private practice in Ithaca from about 2016 until July 21. And prior to Ithaca, I had a private practice in Philadelphia for about 13 years. And before that, I was a psychologist in the Department of Rehab Medicine at Jefferson Hospital in Philadelphia for about 18 years. And I worked with a lot of people who had health and illness related disabilities, as well as, obviously cancer. I used to do consulting on the bone marrow transplant unit. Anxiety and stress and resilience is really a part of the illness experience for pretty much everybody. Today, and we're going to focus on stress and anxiety management. And I don't have any slides, sorry. So I'll be speaking, or actually I'll probably be more reading than speaking, since I haven't really done this in a really long time. So let's see how things go, and feel free to join in if you have questions or anything like that as we go along. So first, let me say that I've selected 4 or 5 of the many websites that are out there that I asked Carla to put in the chat. And so you could click on the links and find a lot of information about anxiety and coping with cancer through them. There's also a number of really, really good books on the topic as well. And just a lot of related resources. So I've selected one that Carla also put in the chat, and it's called the Anxiety and Phobia Workbook, and it's the 7th edition. The author's name is Edmund Bourne. So for starters, I would say the question is, what is stress? And the most commonly accepted definition of it is that it's a condition or a feeling that's experienced when a person perceives that the demand of the situation or the issue exceeds their personal and social resources, so that they can mobilize to handle it. That is that, we feel like we've lost control of the situation and events. Some major big stressors could be illness, obviously, or death, the loss of a job, COVID, traumatic events like, wars, floods, crazy climate change issues, as well as everyday stressors such as deadlines, traffic. What else would you say? Forgetting to do something that you thought you were supposed to do, and basically what happens is that there's a stress response, and that's part instinctual. It's sort of, you may have heard of the fight, flight, or freeze response. It's based on evolution and our development as a species. And it enables our survival. For example, the increased heart rate and blood pressure that you may feel when you're stressed brings more oxygen and blood sugar to our muscles to prepare us to run away or to fight. Hormones such as cortisol kind of help to focus our attention to the threat. And again, also the stress response is partially the way we think, so that we could be thinking, oh my God, this is horrible, I'm sunk, I can't do this, et cetera, et cetera. So in Bourne's book, and I didn't have the capacity to make a photocopy or whatever. If this was in person, I'd hand out photocopies, but I can't. So he has a checklist of symptoms of stress. And there are physical symptoms of stress, and then there are psychological symptoms of stress. And he listed like 26 of each. But I think there's probably more, but I will just read them to you quickly. And you can see whether things that you relate to, things that you've experienced, these particular symptoms of stress. Some of them you do, some of them you don't. So that physical symptoms are, he listed headaches, backaches, tight muscles, neck and shoulder pain, jaw tension, muscle cramps and spasms, nervous stomach, other types of pains, nausea, insomnia, and difficulty sleeping, fatigue, lack of energy, excuse me, cold hands or feet, tightness or pressure in your head, high blood pressure, diarrhea, skin conditions like rashes, allergies, teeth grinding, digestive upset such as cramps, bloating, stomach pain or ulcers, constipation, hypoglycemia, appetite changes, colitis, profuse perspiration, heart beating rapidly or pounding even at rest. Some of the psychological symptoms of stress are anxiety, depression, confusion or spaciness, irrational fears, compulsive behavior, forgetfulness, feeling overloaded or overwhelmed, hyperactivity, mood swings, loneliness, problems with relationships, dissatisfaction or unhappiness with work, difficulty concentrating, frequent irritability, restlessness, frequent boredom, frequent worrying and obsessing, guilt, temper flare-ups, crying spells, nightmares, apathy, sexual problems, weight change, overeating, nervous use of alcohol, drugs, recreational drugs, cigarettes, etc. So you may find that you can relate to some of these symptoms. Like, for instance, I think I tend to have insomnia if I'm worried or stressed, problems concentrating, some loss of appetite, just to name a few. And other people, it's for other people, they'll have other symptoms, obviously. Now, the diagnosis of cancer and the treatment is a major cause of stress for pretty much everybody. And so I thought that we could review what's been compiled about anxiety and stress in general, and hopefully, and stress management. And hopefully, if needed, you can identify and learn some of the, a few more ways to handle your own anxiety and stress. I'm sure you already have them, but this is just sort of expanding what you probably already are doing. The focus of anxiety management is taking charge of what you can do and what you can change, which is a surprisingly large amount of things at times. So remember the Serenity Prayer, which I think was probably made popular, I think, by 12-step programs. And it's, essentially something to the give me the courage to change what I can, and the ability to accept what I can change, and the wisdom to know the difference between the two. And that's a good goal. It's hard to do. One outstanding suggestion that I came across as I've been reading about this is to start a stress journal. So if you are somebody who likes to journal, a lot of people, some people like journaling, some people don't like journaling. So, you know, you decide what works for you. And if you're not a journaler, at least stop and reflect on the following points. Um, for instance, this would be what you might write in your journal or write about. For what causes your stress? To think about, to write that down. How do you feel emotionally and physically? How did you respond? If you responded at all. What works? What made you feel better? What made you feel worse? I think is a good thing to kind of be aware of. Then there are other healthy ways to manage stress that people who study and write about stress pretty much recommend. And I think you've probably heard most of this before, because during the pandemic, like this was like discussed a lot in most media outlets. First of all, physical activity is really important. So everybody recommends do something you like, especially if possible, to do it with another person. Try to focus on how you're feeling in your body as opposed to what you're thinking about in your mind, which is, of course, easier said than done. And if you're not feeling well from the treatment, like go easy on yourself. Like you don't need to like beat yourself up if you're not feeling like doing anything. You know, one of the things that's kind of neat is that the Cancer Resource Center has started this, I think it's called like walk and talk or something to that effect. And that's a really good example of walking and talking, of doing something physical with other people. And it's a way of dealing with stress that really works. So engage socially, like any kind of group, like these kinds of groups. Connect with your people, as they say, my people, which is like your friends, your family, your kids, your coworkers, your church, you know, whomever, neighbors, what have you. Just connect with people. People, if you isolate yourself, it tends to make you feel worse. If you connect with people, you feel better. So like, because talking with another person is just extremely calming, except of course, if the person is really negative, and I mean, I'm sure you're aware of people who are just really negative, but the thing is that if you just by just talk it out with people, it really makes a person feel better. It helps in terms of just dealing with stress. It's like the opposite of loneliness. It's an antidote to loneliness, and loneliness is really difficult to deal with. And in the pandemic, people have written about, a lot has written about that there's been a real increase in loneliness by a huge portion of the population. And while Zoom has helped, it's no substitute, as far as I'm concerned, for meeting in person with people and being with people. So fortunately, we're getting the chance to be more and more connected to other people again. Another suggestion they had about stress was try to learn to avoid unnecessary stress. So that, for instance, learn to say no. Like, I can't do this, or I don't want to do this. Just saying no, which a lot of people have learned, they're not really comfortable doing that, but it's helpful to do that. Let's see, what else? Oh yeah, another thing too, in terms of learning to avoid unnecessary stresses, turn off the news or limit social media, because again, like I think more and more research is showing that like social media like makes people feel worse, not better necessarily. You feel so limiting it, not a bad idea. And practical things true, like maybe driving a less stressful route, leaving a little bit earlier to give yourself more time, so that just cuts those little things make a big difference, excuse me, in terms of stress, how you feel. Um, and then, think of ways that you could alter the stressful situation. For example, talk about how you feel, express your feelings instead of keeping them inside. A lot of people just, stay, locked up inside, and that really hurts a lot. Be willing to compromise, and so that you don't get so mad and be stressed when you don't get what you want. Manage your time better. And then they also suggested adapt to the stressor to the extent that you can, which means to essentially try and change the way that you think about it. For instance, experts say, look at the big picture if you can. Think about what's really important to you. The other thing is that has come out is that if you have like a perfectionistic streak or perfectionistic standards, then you may be really upset, for instance, with hair loss because you're not feeling perfect, or, if you feel that your body has changed and you're feeling really bad about that, to kind of lighten up on yourself and recognize that there's more to you than than your hair or your body. And also, this is part of the serenity prayer, but accept the things you can't change. So don't try to control what's uncontrollable, because then you're going to feel like you failed, and that's the wrong conclusion. So sort of be gentle with yourself, be forgiving of yourself and others too. It helps a lot, make you feel better. And when you forgive yourself, forgive other people, lighten up, things are a little bit nicer interpersonally and intrapersonally. And this is one of the really important recommendations, is to make time for fun. And that's one of the things that people don't do. They make time for treatment, they make time for the kids, they make time for doing all the housework, whatever stuff they have to do, but don't necessarily make time for fun and for relaxation. So examples might be just like, say, playing with your pet, playing with your kids, playing with both your kids and your pets, playing games, watching a comedy, gardening. Some people find that extremely relaxing. Other people don't. Reading a book. Do things that you enjoy every day. And also to try to keep up a sense of humor. There's a book called Anatomy of an Illness by this man, Norman Cousins. It was written a long time ago. He had, I think he had Guillain-Barré and was very sick, and it was like a super slow recovery. And he endeavored to use humor to help him kind of manage his way through recovery, and it was really effective. So you may have heard the expression, laughter is the best medicine, but it is true. So for instance, I have a subscription to this magazine. Well, it's not a magazine, it's a newspaper. It comes out monthly called Funny Times, and it's really funny. And you just, get like a little monthly infusion of jokes. Or, for instance, we subscribe to the New Yorker, and their cartoons are great. So whatever resource you have, whatever outlet you have for comedy, humor, go for it. It helps a lot, more than you realize. Yeah. Another thing that they say, which is, kind of not exactly my my forte, but it's adopt a healthy lifestyle, such as a healthy diet. Now, nutritionists probably have already heard, you have probably already heard about like what you can eat, what you can't eat, blah, blah, blah. Got it. So just the healthy diet is try to decrease caffeine, sugar, alcohol, drugs, tobacco. Those are really important. If you can limit that, that's important. But most importantly is to get enough sleep. And again, this is something that there's been a lot written about recently. But Americans tend to be really sleep deprived, like in comparison to other countries that are similar to us and other developed countries, let's say. Americans get probably like 6 hours a night sleep, and theoretically we're supposed to get like 9. However, that's, I think, unrealistic. But 8, if you're aiming for 8, that's good. And so, you know, basically, if you would look at, say, the Mayo Clinic website about sleep, there's a lot of really good information. You could Google sleep better and you're going to find a lot of good suggestions. The New York Times recently had a couple of articles about ways to improve sleep at different ages. And I think that was really helpful too. So there's lots of information out there, or else, you know, you could talk to your physicians too. They'll give you, you know, besides sleep medication, there's other ways that you can, other things you should pay attention to, but making sure that you get enough sleep is really important. So the other thing we were going to talk about today was the concept of resilience. And really, resilience, there's a huge overlap between resilience and stress management. So, like, what is defined? What is resilience, excuse me, defined as? And so the people that study it define resilience as the capacity to recover quickly from, you know, difficulties, basically toughness. And so think about, like, say, building materials that are resilient, like steel, that, you know, can take a lot of pressure. That's the concept of resilience. And it's the ability then to cope with and recover from setbacks pretty easily. And you know, one of the things that's kind of neat about the concept of resilience is that it's not like an all or nothing thing. You can build up, you can become more resilient by the things that you do. You know, resilience has been studied a lot. My first experience with this whole concept and people studying it was after 9/11, and then Katrina, and now, of course, COVID. We're sort of encouraging people to think about ways to be more resilient is becoming really important. Some expert tips for how to build up resilience. They're really similar to stress management. The first one is that was listed was to develop a core set of beliefs that within yourself that can't be really shaken, that really can't be changed. So say spiritual or religious beliefs, or beliefs in the meaning of life is really, you know, it's obvious that it's important, but it's important. The second thing they said was to try to find some meaning in whatever traumatic or stressful thing has happened. And I think that's a real challenge for people, to try to find meaning in like crazy times, but it helps. And what goes along with this is to try to maintain a positive outlook, meaning like pragmatic optimism as opposed to starry-eyed optimism, being like realistic, but being hopeful about one's ability to cope and that things will improve. Another suggestion was to take cues from a resilient person, someone that you identify as resilient, a role model. I often think, or I think about this woman that I knew in school who she had a great sense of humor, and she would laugh about so many things that the rest of us were like freaking out about and stressed about. She would be like, find humor in it, and she kind of coped a lot better than we did. And I would think, oh, how can we be like more like her? So it's like trying to pick role models to follow and be like them if possible. And so then, one of the things is that to what they call avoid avoidance. Um, don't run away from stress and from things, but just, deal with it. So that, for instance, I was nervous about this presentation and I wasn't thinking about it until I got an email about it. And I was like, oh, I've been avoiding thinking about this. I better think about this. And then I felt better because I was like dealing with it. So avoidance, you don't really fool yourself. In the back of your mind, you're like, this is, out there waiting to get me. So avoid avoidance. And also then similarly, be quick to reach out for support. So there's a lot of people who can just, they want to be part of like a solution for you. They want to help you. They want to be your friend. And it makes people feel better to have people reach out to them. So you're doing yourself and somebody else a favor in connecting. Now this also was something that in terms of stress management, but they focused, the guys that have written about resilience say, find an exercise regime that works for you and that you can stick with. And they use as an example, like one of the authors, he's a power lifter, he like lifts, I don't know, like 200 pounds or something like that with kids. And, that he teaches, I guess he's like the head of a medical school or something like that. But so, he has a lot of young guys around him that are, he goes to the gym and lifts with them. And this other guy's like, definitely not me. I don't do that. So he's like a runner or something like that, or plays tennis. Do something physical. And pick something that you can stick with, as opposed to I'm going to become a marathoner, because most people don't follow through with that. And what else? Don't beat yourself up for your past mistakes. So be kind to yourself and focus on what's positive with you. So that, for instance, if you can think about your strengths, or think about your assets, like I'm friendly, I'm resourceful, I'm persistent. Those are good things. And, don't be afraid to pat yourself on the back. And finally, there are a lot of ways, very important ways that to deal with stress and to increase resiliency that you've probably been familiar with. I can't imagine that anybody hasn't heard about meditation at this point, or mindfulness training, yoga, prayer, Tai Chi, and so forth. Those are all available in the community, and they're really wonderful ways to deal with stress and to develop better ways to cope with stress. So now we have, let's see. I would like to do some progressive relaxation exercises with you, if you would like. And so we start with deep breathing, and then move on to progressive relaxation. And let me see here for a second. All righty. So now at this point, you can just relax, get yourself into a comfortable position, and you can turn your cameras off if you like, whatever works for you, so that you can just concentrate and listen for a little while. So first we'll do just some deep breathing exercises. And so just first of all, get yourself into a comfortable position, and then slowly and gently inhaling deeply, and then exhale completely. Breathing in deeply and exhaling completely. Breathing in deeply, hold for a second, and then exhale completely. Breathing in deeply, hold, exhale completely. And breathing in deeply, holding it, exhale completely. And now we'll continue to do progressive relaxation. So, starting at the top of your head, just begin to think about a warm wave, sort of like if you step outside on a warm spring day and you know how the sunlight feels on your head, on your skin. So just think about the warmth flowing down across your scalp, across your head, your hair, down across your forehead, and release the muscles across your forehead slowly and gently. Breathing in deeply, exhaling completely. Think about smoothing out your eyebrows. You know, sometimes we furrow our brow, we have tension across our forehead that we don't even realize. Just think for a few seconds about allowing those muscles to lengthen and soften as this warm wave continues to flow down your face into your temples, your cheeks, your mouth. Think about allowing your tongue to just rest in your mouth and relax your jaw. We have a lot of tension a lot of times in our jaw. So just move it gently, if you can, from side to side. It just allows yourself to release a little bit more, a little bit more. Think about this warm, soothing feeling flowing down back of your neck, front of your neck, across your shoulders. Allow your shoulders to drop back and down. Rotating your head just slightly from side to side. Just allowing your muscles to release a little bit more with each move. And then again, breathing in deeply and exhaling completely. And with each exhalation, releasing and relaxing just a little bit more. Think about this warm and soothing wave flowing down across your chest, down your back, into your gut. We often hold a lot of tightness and tension in our stomachs, in our gut. Just allow those organs, internal organs, to just release, relax a little bit, using your breath as a guide, breathing in deeply, exhaling completely. Think about this warm and soothing wave flowing down across your shoulders, down your arms, upper arms, forearms, wrists, palms of your hands, fingers and fingertips. You can just gently rotate your wrists from side to side, just releasing any tightness, again, any tension. And this warm and sort of soothing wave just continues to flow down your body and your hips and your thighs. Allow, if you're sitting down or lying down, allow yourself to be just supported by the chair or the couch or the bed, the floor. And this warm, soothing wave flows down your legs, into your feet, your ankles, soles of your feet, your toes, just moving your feet slightly from side to side just allows a little bit of the tightness, a little bit of tension to release. And then you may want to just check throughout your body and see where there's some areas. We all have areas where there's still tightness, still some tension, still some stress. And think about just relaxing them a little bit. That's all. The more you do this, the easier it is to just allow yourself to take a break. Using your breath as a guide, breathing in deeply, exhaling completely. With each inhalation and exhalation, letting go a little bit more of the stress of the day, of life right now. And in a few seconds, we'll just begin to become more awake and alert again. So giving yourself another couple of breaths, breathing in deeply, exhaling completely. And now I'll count to 10. And as I count to 10, gradually you become more awake and alert, a little bit more rested, a little bit more refreshed. 1, 2, 3, 4. Just gradually beginning to move a little bit. 5, 6, 7, 8. Getting ready to just begin to open your eyes gradually, feeling rested and refreshed. 9 and 10. And just taking a few seconds to allow yourself to just transition back to the day. And this is something that you can practice on your own. There's lots and lots of relaxation type of resources out there. In the Anxiety and Phobia Workbook, the author has allowed, well, how can I describe this? I own the book. You were able to download the, yes, 10, I think, relaxation types of exercises. And so I sent them to Carla, who would be able to send them to you. And then you can listen to them. And again, that helps with your, learning the skills of relaxation. And there's lots of different techniques out there. If you send Carla or the Cancer Resource Center your name, and if they have your email, that's good. If not, give them your email and they can email you this, or you can email me if you want to, or contact me via the Cancer Resource Center. My email is drkreidy@gmail.com. And I'm happy to forward you the relaxation exercises from Bourne's book as well. And one final thing I wanted to say was that if you feel like you would like assistance with, dealing with anxiety or stress and you want to see a therapist, I can help you to connect to somebody in the sort of Ithaca area. There's an Ithaca therapist group that has an email list, and I'm happy to put out a request for therapists that are available if someone is looking for a specific something. So again, that's another thing, to either contact me or the Cancer Resource Center, me via the Cancer Resource Center, to help you find somebody that you might want to work with who can help you continue to deal with stress management. Specifically about cancer, but let's face it, life is stressful. So it's not just cancer, it's life. And we all have to learn how to deal with it. So I thank you all very much. I guess that's about all I have to say. Does anybody have any questions or anything like that? If you do, you're welcome to put it in the chat. If not, I guess we can stop. Anyway, thank you guys very much for your time and attention. Bye.